to know you, Jesus.
Professor C.C. Wilson, the inaugural lecturer and his spouse, and the Deputy Vice Chancellor, Enugu campus. The national anthem, please. The University of Nigeria song.
Yes.
University of Nigeria, my alma mater, while we're still standing, permit me to make welcome Emeritus Professor Ernest Onwasigwe, to please say the opening prayers for us.
Let us pray. Our most gracious Father, we thank you for this wonderful day of bringing us together. Lord, we thank you for joining mercies. We thank you, gracious Lord, for the testimonies of this day that you have come together to share of your faithfulness and your indescribable grace upon our lives. Heavenly Father, we've gathered again in matters of the heart. Above all things, gracious Lord, we pray, bless us with the consciousness that there is a heart which you have to circumcise and which you have circumcised in Christ. In all things, gracious Lord, at the end of time, may we go rejoicing, for we are prayed in the name of the Father, and of the Son, and of the Holy Spirit. Thank you.
Principal officers of the University of Nigeria here present, distinguished academics, my Lord spiritual and temporal, members of the press, members of the fourth estate of the realm, lions and lionesses, ladies and gentlemen. It is my pleasure to welcome you this afternoon to this very wonderful academic discourse, the 204th in the series of inaugural lecture of this great institution. Today we'll be listening to a topic that says the order high BP, which looks like heart failure, but also causes sudden death. And doing justice to that, to recognize him specially. But for now, permits me to delve into recognizing the members of the high table. Today I'll be calling on a man who's acting in double capacity. He's representing the Vice Chancellor of this great citadel of learning, and also as himself as the Deputy Vice Chancellor, Enugu campus. Ladies and gentlemen, please put your hands together for my boss, Professor Daniel Nwachukwu. Seated next to the DVC and the Vice Chancellor is the Provost, College of Postgraduate Studies, Professor Obi Njoko. Next to him is a man who called the constant in every inaugural lecture, Emeritus Professor C.C. Nwosu. Please put your hands together for him. We also have the CMD UNCH, Professor Obinna Onandugo. You're very welcome, sir. The Chairman, Senate Ceremonials, Professor B.C. Nwanguma. Please appreciate him. The Provost College of Medicine, Professor Hygienist Ezegui. Please put your hands together for him. We also have the Deputy Provost College of Medicine, Professor Kajetan Onyedum. Please appreciate him. Representing the Dean of Faculty of Clinical Sciences, we have the Associate Dean, Professor Obi Okoye. Please appreciate him. While I wait for the name of the lady over there, let me quickly recognize the past inaugural lecturers in our presence. Professor J.C. Eze, Oracle, past inaugural lecturer. Professor Chindi Chuka Okosa, past inaugural lecturer. Professor Edirin Ogechuku Omeje, past inaugural lecturer. My own very mommy, the immediate past Deputy Vice Chancellor of this great campus, Professor Edith Nwosu, past inaugural lecturer. Please put your hands together for her. You're very welcome, ma. Professor Yuzubus Ezugo, past inaugural lecturer. Professor Ugoke Eze, past inaugural lecturer. Professor Felix Chukuneke, past inaugural lecturer. Professor Onyedun Kajetan, I think I've recognized him. Ambassador Professor J.N. Wosu, past inaugural lecturer. Professor Obi Samuel, past inaugural lecturer. Professor Cyril Deem, past inaugural lecturer. Professor Sylvester Nwokedioko, past inaugural lecturer. Emeritus Professor B.C. Ezanolwe, past inaugural lecturer. Professor Ozemena, past inaugural lecturer. Professor E. Joma Eyemere, past inaugural lecturer. Professor Bansin Onwubere, past inaugural lecturer. Professor Maduka Oasoro, past inaugural lecturer. Venerable Professor Sam Ike, past inaugural lecturer. Professor Val Ugu, past inaugural lecturer. Professor Uche Nawa, past inaugural lecturer. Professor Henrietta Uchi, past inaugural lecturer. Professor Chinawa Josephat, past inaugural lecturer. And also Emeritus Professor Ernest Onwasigwe, past inaugural lecturer, former Provost College of Medicine. So on the high table, I did not recognize a very special lady there. Please, ladies and gentlemen, put your hands together for Emeritus Professor Nene Elsie Obianyo. I appreciate her very specially. During the course of my recognition, you would likely agree with me that I did not recognize the inaugural lecturer and his beautiful spouse. Ladies and gentlemen, permit me to recognize in our midst the 204th inaugural lecturer of this great institution, Professor Emmanuel Chukwudi EJIM. Please, can you put your hands together for him? Like they rightly say, besides every successful man is a beautiful, successful woman. Distinguished ladies and gentlemen, I want you to be very partial with this particular person I want us to recognize. Put your hands together for Mrs. Ogechukwu EJIM, the wife of the inaugural lecturer. You're very welcome, ma'am. I want to recognize the former Vice Chancellor, the 14th Vice Chancellor of this great institution. 13th, sorry. The 14th is Professor Charles. Please, ladies and gentlemen, put your hands together for Professor B.C. Ozumba. Emeritus Professor B.C. Ozumba. Please appreciate him very specially. We'll take recognitions, but before that, I would like to call on the chairman to proceed with this event because we're far behind our scheduled time. So, but after that, we'll be taking special recognitions. All right, so I'll hand the microphone over to the chairman, but before I do that, I want to recognize the 12th Vice Chancellor of this great institution, Emeritus Professor Bath Okolu. Please appreciate him very specially. You're welcome, Prof. We recognize you. So permit me to hand the microphone over to the chairman at this juncture, Professor B.C. Nwangoma, to continue with this event. Professor.
Thank you very much, Joyce. But good afternoon, distinguished ladies and gentlemen, special guests at today's inaugural lecture. On behalf of the Senate Ceremonials Committee, it's my delight to have you all in the hall today. As you know, this is inaugural lecture number 204, the 204th inaugural lecture, to be presented by the busiest dean as long as the inaugural lectures go. And he got stampeded into taking a date and presenting his inaugural lecture because we thought he had read the citations of many lecturers from his faculty. And he took the bull by the horn, and today we're happy that the Dean of the Faculty of Medicine, now Faculty of Clinical Sciences, Professor Emmanuel EJIM is going to present the 204th inaugural lecture, and his topic is the other high BP, which looks like heart failure, but also causes sudden death. The other high BP, which looks like heart failure, but also causes sudden death. It's my pleasure at this point, therefore, to invite the chairman of today's inaugural lecture, the Deputy Vice Chancellor of Enugu campus, who is standing in for the Vice Chancellor. So please welcome with me Professor Daniel Nwachukwu for his opening remarks.
Good afternoon, ladies and gentlemen. The Vice Chancellor of this great university, Professor Charles Arizechukwu Iwe, principal officers of this university here present, the 13th and 14th Vice Chancellor of this university here present, Professor Bato Okolo and Professor B.C. Ozumba, we appreciate your presence. Emeriti professors here present, distinguished members of the University Senate, distinguished professors, heads of academic and administrative units, my Lord, spiritual and temporal, members of the Fourth Estate of the Realm, and gentlemen of the press, lions and lionesses, ladies and gentlemen, I want to welcome all of us to the 204th inaugural lecture of the University of Nigeria. I mean, we've been very busy this period. We've gathered here once again to take on another inaugural lecture, and the topic of this lecture is quite interesting. It also has to do with blood pressure, but in this case, is the other high blood pressure, which looks like heart failure, but also causes sudden death. I believe there won't be any sudden death among us in the mighty name of Jesus. So that other high blood pressure will be identified today. Just listen carefully, because we know who is giving this lecture is an eminent scholar in this field. And we can't wait to see that other high blood pressure, so that we'll take precautionary measures. Even if it is taking Zobo, we can take it to prepare. So all we need to do is to listen. We need to listen to this other high blood pressure, take precautionary measures to ensure that there won't be any sudden death among us. Ladies and gentlemen, on behalf of the Vice Chancellor, who is unavoidably absent, I want to welcome all of us to the 204th inaugural lecture. The time is fast spent and we have to be fast. On behalf of the Vice Chancellor, I want to declare this inaugural lecture open. Thank you.
Thank you very much. It looks like the chairman will be strict with the timing today. So that's a warning to the inaugural lecturer. And so at this point, it's my pleasure to invite the Associate Dean, the Faculty of Clinical Sciences, Professor Obiekwe Okoye, to read the citation and formally introduce the 204th inaugural lecturer, Professor EJIM.
Thank you. The Vice Chancellor, all protocols duly observed. Professor Emmanuel EJIM was born on the 22nd of July, 1971 at Opaluibo in the Suka local government area of Enugu State, to Chief Christian Tinabuike and Mrs. Regina Ozamaka, who were both primary school teachers. His formal education started in his hometown at Community Primary School, Ogwofia Owa, Ezeagu local government of Enugu State in 1976, and then continued at Community Primary School Nguru, Nsukka from 1977 to 1981, and finally at Central School 2 Nsukka in 1982, where he obtained his first school living certificate. It was at Central School 2 Nsukka that he discovered his talents, which we are going to be seeing today, courtesy of Mrs. Ugwo Ejiono Uwezoke, the best teacher he ever had. He started his secondary education at Nsukka High School in 1982 and graduated in 1988 as the best graduating student from the school. Admitted to the University of Nigeria in 1988 to study medicine as a member of the 1994 OMSA class. In 1995, he graduated with distinctions in medical biochemistry and human anatomy, and was also the best graduating student in medical biochemistry at the 1991 second MBBS professional examination, and also the best graduating student in the Department of Pediatrics during the fourth MBBS professional examination. The mandatory one-year housemanship was at the University of Nigeria Teaching Hospital Enugu, while National Youth Service was at the General Hospital Gashua in Yobe State, where he gathered surgical skills. He worked at Mother of Mercy Hospital, Ihe, in Inaugural, local government area of Enugu State, from 1977 to 1999 as a medical officer. There, he put his surgical skills to use, culminating in the performance of resection and anastomosis of the small intestine in 1999. Now we are worried why he has to go to become a cardiologist. While at Ihe, he got married to his late wife, Chinelo, and they had their first two children there. He joined the residency training program of the Department of Medicine, University of Nigeria Teaching Hospital, in August 1999 as a junior resident, and completed the program in November 2005, when he got the fellowship of the National Postgraduate Medical College Cardiology Subspecialty. He served as the chief resident of the Department of Medicine from January 2003 to December 2004, and was appointed as a hospital consultant physician and cardiologist in the Department of Medicine in October 2006. He had further training in congenital and structural heart disease at the Katholieke Universiteit Leuven, Belgium, in 2009 and 2016. He joined the University of Nigeria as a senior lecturer in June 2011 and was promoted to the rank of full professor of medicine on the 1st of October 2017. In the course of work, he has served in several departmental, faculty, college, and university committees. In 2020, he was appointed the Associate Dean of Faculty of Medical Sciences, and by 2022, elected the Dean of the Faculty, a position he has held till date. Professor EMMANUEL EJIM is a fellow of American College of Cardiology. He's a fellow of European Society of Cardiology. He's a fellow of National Postgraduate Medical College of Nigeria, Medical College of Nigeria. He's a graduate of University of Nigeria, Nsukka, as we have earlier mentioned. He has been a standard examiner in medicine for Nnamdi Azikiwe University, Awka, 2017 to 2021. He's an honorary consultant cardiologist, University of Nigeria, 2011 to date. Part-time consultant cardiologist at 82 Div Headquarters Military Hospital, 2090 days. I've been a standard examiner in medicine, Enugu State University of Science and Technology, since November 2021 to date. is a member, American College of Cardiologists, European Society of Cardiologists, European Heart Rhythm Association, International Society of Hypertension, Nigerian Cardiac Society, and Nigerian Hypertension Society. And of course, a member of Nigerian Medical Association. Professor Emmanuel EJIM have enjoyed several traveling grants from the International Society of Hypertension, European Heart Rhythm Association, Novartis Pharma, Pfizer Pharmaceuticals, Sanofi, Famsi Nigeria Limited, Boehringer Ingelheim, Bayer Pharma, Micronova, Healthline Pharmaceuticals, and others. He has special interest in echocardiography, cardiac pacing, and congenital heart disease in adults. Professor Emmanuel EJIM had been, of course, had held several leadership positions. I'm going to mention a few of them. First, Chairman, Expert Medical Advisory Committee to the Enugu State Government on COVID-19, July 2020. Southeast Zonal Coordinator, Continued Medical Education Nigeria Medical Association from September 2016 to 2018. He had had a short stint as head of department, acting Department of Medicine, University of Nigeria at Enugu campus, July 20th to July 27th, 2015. He had been member, Board of Management, University of Nigeria Teaching Hospital, Enugu, representative of the Vice Chancellor of the University of Nigeria from February 2013 to July 2014. He had been Chairman, National Committee on Project Initiation and Implementation, Nigeria Medical Association, August 2010 to April 2012. He had been Secretary, Nigeria Medical Association, Enugu State Branch, 2002 to 2004, where he went on to be elected Chairman, Nigeria Medical Association, Enugu State, in August 28, 2008, up to July 2010. He's also a spiritual man. Of course, he has been president. He has been the president of Act of Covenant Presidium Legio Maria, UNTH Enugu, December 2001 to 2007, 6 years at the stretch as a president. Professor Emmanuel EJIM has been a member of editorial board of Annals of Medical and Health Science Research from 2010 to 2016, and he has reviewed articles for several local and international journals, and is still reviewing. Professor Emmanuel EJIM have enjoyed research grants and contracts, two of which is very worthy to note today. One as the principal investigator, site number 1788, registry 1160.77, where he did a great job on risk factors, treatments and outcomes for emergency department patients with atrial fibrillation in multiple regions of the world in February 2010 to March 2011. He was also the principal investigator, prevalence of cardiovascular risk factors in patients attending general practice clinics in Africa and the Middle East. AFME Cardiovascular Epidemiology AC study, fully sponsored by Pfizer. Professor Emmanuel EJIM has over 60 publications in peer-reviewed journals to his credit, most of which are in journals with UNN recognized impact factor. He has presented academic papers at conferences in all parts of the world, And I can tell you, he's just returning from United States of America for one of those functions. Professor Emmanuel EJIM is a community man. It's not a, of course his hometown is very close by, so he finds it easy to shuttle and participate actively in social and political activities in his hometown, Ogwosho Owa, in Enugu local government of Enugu State, and holds the title of Udo Kama in his village. So anywhere you see me, Udo Kama, you will answer. He's an active member of the Legion of Mary, one of the pious societies in the Catholic Church at the old site. Professor Emmanuel EJIM enjoys traveling and watching the game of the round leather objects. I don't know his favorite team, Man U, the failing team. He is happily married to the beautiful wife by his side, Mrs. Ogechukwu EJIM, and altogether in his entire family, he is blessed with 7 children, and still counting, and still counting, and still counting. Ikechukwu, Ugochukwu, Chisom, Chinaza, Chidebere, Chisimdi, Tobechukwu. The Vice Chancellor, ably represented by the DVC UNEC, Professor Dan Nwachukwu. I hereby present to you the 204th inaugural lecturer, Professor Emmanuel EJIM.
The chairman of the occasion and the Vice Chancellor of University of Nigeria, represented by the DVC, I present this inaugural lecture with mixed feelings because the person who taught me most of the things I'm going to talk about is lying in the mortuary, in the person of Professor Benedict Anisuba. Also because I remember 11 years ago, at about this time, when Professor Bazin Omubere, my mentor, was delivering his inaugural lecture, my wife was also lying in the mortuary, my late wife. So it brings back a lot of feelings. So this is the outline. So the Vice Chancellor, Professor Arinzechukwu Igwe, ably represented by the Deputy Vice Chancellor UNEC, my very good friend, Professor Dan Nwachukwu, other principal officers of the university here present, the Provost of College of Medicine, Provost of the Postgraduate College, members of the University of Nigeria Governing Council, Deans of Faculties, Dean of Student Affairs, my very good friend, Chairman of Senate Ceremonial Committee, a man I like very much. directors of institutes, past inaugural lecturers present, members of the University of Nigeria Senate, distinguished academic staff, administrative and technical staff of the university, members of my family, my lords, spiritual and temporal. You can see so many priests. My parish priest is here with his assistants. Distinguished guests, gentlemen of the press, great on-sites, our medical students, lions and lionesses, ladies and gentlemen. This lecture is dedicated to my late wife, Chinelo Kalista EJIM, who died on the 13th of February, 2013. Well, I'm grateful to my parents, to God first of all, for bringing me this far. I'm also grateful to my parents who trained me. My father actually wanted to be a medical doctor, but his own father couldn't train him. So I appreciate our Vice Chancellor for giving me the opportunity to deliver this lecture, and my guests, all of you, for making out time to come and listen to my story. When I was appointed a professor, I didn't remember that one was expected to deliver an inaugural lecture. It was when I was associate dean to Professor Yedum, when he was talking about his inaugural lecture, that I remembered that there was a responsibility to deliver an inaugural lecture, because you can see this is 204. I'm sure the University of Nigeria has had more than 1,000 professors. So people don't actually remember this thing. I'm also grateful to the Vice Chancellor. When we went for condolence, when his in-law died, he asked me, have you delivered an inaugural lecture? I said no. Again, the second time he asked me, I knew that something needed to be done. Then Professor Obinna keeps on teasing me each time I file into this clause for inaugural lectures that I should stop filing with the past inaugural lecturers. I'm not qualified to be with them. Then Professor Bennett Wanguma has named me the busiest dean in the Ogun University in terms of inaugural, because I keep on reading citations almost on a monthly basis. At least I know that after this he won't ask me that question again. So internal medicine, so how did I get into internal medicine? In 1991, when I did my first clinical posting as a medical student under late Professor J.M. Odili, at the end of the posting, I knew I wasn't going to be a surgeon. That wasn't my calling. Even though I knew that to work well in Nigeria, you needed some surgical skills. Dr. Gabe Njeze made every effort to convince me to be a surgeon, but he failed. After my Part 1 examination in 2002, it was clear to me that cardiology was going to be my destination because of the influence Professor Onwubere had on me. And in cardiology, echocardiography was naturally the in thing then and had to be a point of interest, because at that time, UNTH performed so many cardiac surgeries, and the complexities and the very varied nature of anomalies we saw in echocardiography made it a very interesting area to home into. So in the course of doing echoes, doing echo is ultrasound of the heart. So using a machine to look at the structure and function of the heart. And congenital heart diseases are illnesses that individuals are born with. Like you said, a child is born with a hole in the heart, or born with no eye, or born with, so they are called congenital heart diseases. And a lot of them we were seeing then. Some of them, of course, we were scanning both adults and children at that time when we were training. So, but a lot of them came to us as adults. And because of those complex structural abnormalities, I got a lot of interest in adults with congenital heart disease. So in 2016 and 2009, I went to Belgium for a fellowship in congenital heart disease. Most adults who have congenital heart disease, especially the ones who call the shunt defects, those the people who have holes, either a hole between the two chambers of the heart in the upper parts or a hole between the lower chambers. There is a type of hypertension that is common to all of them. So by the time they become adults, carrying those holes from childhood to adulthood, they would have developed a type of hypertension which actually brings them to hospital most times. The last two inaugural lectures from our cardiology units were on hypertension. Both Professor Bassey Onwubere and Professor Sam Ike, they all talked about hypertension. So I felt that I also needed to talk about hypertension. However, I'll talk about a different type of hypertension. And also the need to create awareness as to the existence of a hypertension that we really talk about. People don't really refer to it. I'm sure Venerable Professor Onwasigwe has repeatedly told me in the last 1 month, since I brought out this topic, that everything about hypertension has been discussed. I was wondering what I'm coming to talk about. He even mentioned that now that the DVC said that Zobo is now a treatment, that I shouldn't talk about hypertension again. But I refused, and instead I'm going to talk about hypertension. So, hypertension or high blood pressure is a term most adults have heard about. I'm sure most people here have heard about hypertension. Even though only a fraction of those who are here, or those who have heard about it, know much about hypertension. And high BP is the layman's name for hypertension. And it is defined as sustained elevation of blood pressure when the upper reading is up to or above 140 millimeter mercury, or the lower reading is up to or above 90 millimeter mercury, when the blood pressure is measured in a hospital setting, not in your house or when you're sleeping and all that. This is the value used for hypertension measured in the hospital setting. But it needs to be sustained. I mean, so it needs to persist. Day 1, day 2, day 3, day 4, and all that. Because if a real lion comes into this place now, most of us start running. And if I measure your blood pressure, maybe 200, it doesn't mean you're hypertensive. That elevation needs to be sustained for some time. If your BP is measured at home or at night or over 24 hours, different values are used to define hypertension. And on this high table, I'm sure if we're about 30 here, for instance, I'm sure more than 12 people here will be hypertensive, because 4 out of every 10 Nigerians have high blood pressure. And the danger with high blood pressure is that oftentimes it doesn't cause headache, it doesn't cause fever, it doesn't cause diarrhea, it doesn't cause loss of appetite. So the individual will not have any need or any reason to visit the hospital. It's also known that the first symptom of hypertension in an individual may be stroke or heart attack or even sudden death. At that time, the person will no longer be there to know what killed him or her. We also know that high blood pressure damages the eyes, damages the brain, damages the kidney. These are all in literature, blood vessels and all that. And the primary reason for asking people to take medications for blood pressure is to prevent these structural damages. If high BP were not destroying the eye, the brain, the heart and all that, it wouldn't be an illness. Equally known is the fact that if you take BP medications, you're able to reduce this danger of having a stroke by up to 30%, danger of having a heart attack by up to 23%, and danger of having death from heart-related matters by up to 18%. However, all this knowledge, all this I've talked about, are just about one type of hypertension, the systemic hypertension. The other type of high blood pressure is rarely mentioned. It is not routinely measured and does not seem to matter, but also kills like systemic hypertension. So what is that other hypertension? So like I said, that high BP is a layman's term for the medical term hypertension. And it simply means the force which circulates blood around the body. That's what blood pressure is all about. The force that moves blood around your body. So when this force rises to an extent that it starts causing damages in different parts of the body, you say the person has hypertension. So the value used at 140/90 may sometimes not be applicable to everybody. So blood circulation through the body is divided into 2 parts. Blood flow from the heart to the lungs is called pulmonary circulation, while blood flow from the heart to the other parts of the body is called systemic circulation. So systemic hypertension refers to systemic circulation, does not refer to blood pressure in the lungs. So the force which circulates blood between the lungs and the right side, because heart has right and left sides, the force which circulates blood between the right part of the heart and the left part is called the pulmonary blood pressure, while the force which circulates blood between the heart and other parts of the body is called the systemic blood pressure. For over a century, the measurement of systemic blood pressure has been a part of routine medical examination. Like if you go to hospital and if you go to see a doctor and it doesn't check your blood pressure, then that person is not a good doctor. That the minimum a doctor can do for you is to check your blood pressure and check your pulse, because it saves lives. So this is because it is known that early detection of hypertension increases the chances of better control, increases the chances of prevention of hypertension-mediated organ damages. Unfortunately, there is no equivalence of the standard BP machine, that thing tied on that is tied on the arm. There is no equivalence of that, which can be used to measure pulmonary blood pressure. I'm sure all of us here respect Venerable Professor Nwasigwe. If I ask him when was the last time he checked his pulmonary blood pressure, you'll be surprised at his response. He has never. And my deputy provost, who is a specialist in lung diseases, if I ask him when was the last time he checked your pulmonary blood pressure, you'll be shocked. He has never. Am I saying the lie? Am I lying? So the implication of this is that people who have high blood pressure in their lungs only come to hospital when they have complications. So it is akin to seeing somebody with hypertension after he has a stroke, or has had a heart attack, or has had kidney damage, or had fat failure. So it's actually the symptoms of damage in the lungs that they have that bring them to hospital, because we want to routinely measure the blood pressure in the lungs. At this point, treatment is directed more to the complications than to the illness that primarily caused the complication. Currently, the good news is that currently, pulmonary blood pressure can be measured accurately. But for you to measure it accurately, you may need to bring out 500,000 naira to do your pulmonary blood pressure in a cath lab. A cath lab is a theater-like place where your blood pressure in the lungs can be measured directly. I'm sure most professors earn less than 500,000 a month and will not be able to do this measure pulmonary blood pressure. But in cardiology, we can estimate the pulmonary blood pressure using echocardiography. So I want to reassure Professor Nwasigwe that the last time I did echo on him about 5 years ago, I actually measured his pulmonary blood pressure, but I didn't tell him. And when Professor Edum became dean in 2020, I measured his pulmonary blood pressure, but I didn't tell him. So when I joined the cardiology team in 2003, I joined the cardiology team in 2003 after spending 12 months in respiratory unit as a senior registrar. And that was how the cardiorespiratory surgeon began, because some people were asking me, why are you talking about pulmonary blood pressure when you're a cardiologist? But it is the heart that eventually pumps the blood. So hypertension belongs to us, not to the nephrologists or to the, I'm sure Bino Onodugo is not happy. At that period, UNTH and the few hospitals in Nigeria were the only centers who had well-established echo labs. That's echo lab is ultrasound of the heart. So that time, the slogan myself, Dr. Ime Essien and Dr. Bonas Harry, we were senior registrar then. We said that we go die for this echo room. And we tried to live by that statement. Professor Benedict Anesiba, of blessed memory, he took us to the echo lab, 3 of us. He held our hands, showed us everything we needed to know about echocardiography. This humane and composite clinician taught us echocardiography from the rudiments and guided us to become good cardiologists as well as echosonologists. May his soul rest in peace. So this is the machine that we were taught with. In the year 2003, when Kanu Nwankwo Heart Foundation came to UNTH, they came with this machine. And this Hewlett-Packard Sonos 5000 machine was what we used to learn echo, myself and the 2 other guys I mentioned earlier on. By 2007, when we moved to Ituku-Ozala, the hospital bought this sonoscope machine. But by 2010, the University of Nigeria, through TET Fund, purchased 2 beautiful machines for us. Vivid 7 echo machines made by GE. In short, between 2010 and 2019, between 2005 and 2015, this was the best machine in the whole world. And the University of Nigeria bought 2 for us, courtesy of the then Vice Chancellor, Professor Bato Okolo. By 2013, we had migrated to start using the laptop-sized echocardiography machines. And then currently we use this Vivid GE IQ machine. This is a simple structure of the heart. For those of you who did biology, you call this oracle in biology. I don't know whether I see the pointer. call this auricle in biology. And then this is the right auricle, left auricle, then this is right ventricle, and then left ventricle. This is the simplest way to talk about the structure of the heart. But blood coming back from the from the legs and the tummy and all that, they come back to the right auricle. The ones coming from the head and neck come back to the right auricle, and then through the tricuspid valve, they enter the right ventricle, and from there, they go into the lungs to go and get oxygen. So after oxygenation in the lungs, the blood will come back to the left part of the heart through the pulmonary veins, these two spikes here, into the left atrium, left ventricle, and then from left ventricle, they enter the aorta to supply oxygenated blood to the different parts of the body. So in the course of training in cardiology and in the course of echocardiography, one observation that kept on worrying me was the finding of dilated right heart chambers. That's the right auricle or right atrium and the right ventricle. When we see them dilated in people who don't have holes in the heart, oftentimes we concluded that they had a disease called endomyocardial fibrosis, an illness that has no treatment. So whenever we made that diagnosis, it meant that we could do nothing for the patient. But it was certain that some things were not right with our diagnosis at that moment. So this is a picture of echocardiogram. That's an echocardiogram. This is a normal echocardiogram. This is the right part of the heart. This is the left. So the left part of the heart is always larger than the right in normal people. But if you look at the image on the right, you can see the right atrium has become so large compared to the left atrium here, and the right ventricle has become very large compared to the left ventricle. So whenever we see these pictures, and then if there are some fibrous tissues or some opacities at the apex of the right ventricle, we concluded they had endomyocardial fibrosis, and of course, we could do nothing for them. Just watch them die most times. So, Ike et al. Had reviewed the echocardiogram reports of over 2,500 patients done at UNTH from 1991 to 2001. In that particular paper, there was no single diagnosis of stand-alone pulmonary hypertension. So meaning that we didn't have it. That was the meaning then. We had also published a paper on sickle cell patients, because sickle cell patients, when they become adults, one of the problems they have is that they have pulmonary hypertension. So we had published a paper titled Echocardiography Screening for Pulmonary Arterial Hypertension in Adults with Sickle Cell Anemia in the College Journal. That was in 2009. In that particular study, only 5% of the study group had pulmonary hypertension, and it was a very low figure. So we still believe that it wasn't common in our place, even among sickle cell patients. In 2011, we published another paper titled Atrial Septal Defects, presenting initially in adulthood the patterns of clinical presentation in Enugu, Southeast Nigeria. In this paper, because when people have holes in their heart as children, by the time they get to adulthood, like I mentioned, most of them will come to hospital because of features of pulmonary hypertension. That's actually what brings them to the hospital, not the hole. So, but that paper, the conclusion was that adults with atrial septal defects, which are not corrected, present with features of heart failure. That was the conclusion. So, EJIM et al. Also reviewed the echo reports of 608 patients done at Conquest Imaging, a private laboratory in Enugu, over a 2-year period from 2009 to 2011. And in that review, there was no single diagnosis of standalone pulmonary arterial hypertension. This is a machine we use at Conquest. So, as we continue to grapple with the non-existence of pulmonary hypertension and the fact that most people had dilated right heart chambers, had endomyocardial fibrosis, in August 2015, we had another patient with endomyocardial fibrosis in quotes. And expectedly, she was not doing well in the ward. So we decided to have another look at the heart. And one striking thing was an elevated pulmonary artery systolic pressure. We introduced Viagra. I'm sure most people know about Viagra. We gave the woman Viagra. And within 1 week, to be sincere with you, within 1 week, the woman said she had got well. But we didn't believe her because the improvement looked too real to be true. That marked the beginning of my interest in pulmonary arterial hypertension. So the following year in 2016, I went for a fellowship at the Catholic University of Leuven in Belgium under Professor Werner Boots, a cardiologist with interest in structural and congenital heart disease in adults. And on one occasion, I asked him what was the commonest cause of pulmonary arterial hypertension in Central Europe. He said that it was thromboembolic pulmonary hypertension, and I told him that it was not found in our environments. So on return from Leuven, I went in search of thromboembolic pulmonary hypertension, which ultimately led to a focus on what we are discussing today, chronic thromboembolic pulmonary hypertension. Ladies and gentlemen, so I welcome you to this discussion on chronic thromboembolic pulmonary hypertension, also called CTEPH. It is one of the types of pulmonary arterial hypertension. Like I mentioned earlier on, pulmonary hypertension is often not remembered, is not recognized, and is not discussed, and has therefore remained a cause of sudden death, particularly in our environment. So pulmonary hypertension simply means high BP in the lungs. Because like I mentioned, the BPs we measure when they tie something on your arm, they are systemic blood pressure. They don't tell you anything about what is going on in your lungs. And it is said to be present if the pressure in the lungs measured at rest by that machine I told you that costs about 500,000 to pass through, if the mean pressure, the average pressure is up to 20 millimeter mercury. But the range of BP in the lungs is like 13/6. If you measure your BP on your arm, you get something like 120/80, which is a normal blood pressure. But in the lungs, it's as low as 13/6, or maximum 26/16. So you can see the systemic blood pressure and the pulmonary are far wide apart in terms of values. So because lung is a low pressure area in the body, so that when there are small rises in the pressure, it starts causing serious problems. CTEPH is a type of pulmonary arterial hypertension in which the lumen of the blood vessels in the lungs is blocked or narrowed by blood clots. When this blood, just like I'm likening it to maybe if you put a hose on in a tap in your house and connect it to a bucket, if you introduce small stones inside that hose, they may get to a point where they get stuck and water can no longer flow in the hose. That's what happens in thromboembolic pulmonary hypertension. Either a clot, a thrombus, forms inside the pulmonary vessels, or they can come from the legs or the thighs in people who have DVT, that's who have clots in the legs. So this damage slows blood flow through the lungs with a rise in pulmonary blood pressure in the lungs. At this stage, the heart must work very hard to pump blood through the affected lung. And this extra effort by the heart leads the heart muscles to, because the muscles of the right part of the heart are very flabby. They are not as thick as the ones on the left. So when the pressure is high, the right heart tries makes effort to pump blood to the lungs, but it fails eventually. And you can see the person has a right heart failure. CTEPH is a potentially life-threatening condition and is associated with high morbidity and mortality. However, advances in medical therapy and surgical treatment have markedly improved the outcomes. What causes CTEPH? In a lot of cases, it is consequent upon a previous acute pulmonary embolism in combination with risk factors that make people form clots unduly, because blood clots in the body is supposed to be a physiologic thing. If you have an injury on your skin, the body forms a clot to prevent you from losing blood. But some individuals are forming clots where there is no injury. And that clot is called a thrombus in medicine, and that is what creates this type of problem. So chronic thromboembolism often results in CTEPH and even overt right heart failure. The typical heart, in terms of anatomy, has 2 upper chambers and 2 lower chambers. So each time blood moves through the heart, the lower right chamber pumps the blood to the lungs through a large vessel, a large pipe called the pulmonary artery. Blood usually flows through this vessel in the lungs, and from the lungs, they get back to the left part of the heart. So this blood, from which blood flows to the lungs, and the ones that return the blood to the heart are called the pulmonary blood vessels. This is a diagram of the body showing most of the major blood vessels. We shouldn't bother ourselves. We've got all these other ones here, these ones, the ones to the head, the ones in the hand, legs, are involved with systemic blood pressure. But the one we're going to talk about today just involve these 2 vessels on 4 vessels on the right, and the ones there, just these vessels beside the heart. I'll put a better image, a bigger image. So we're talking about blood flowing from the lower part of the body, upper part of the body, into the right auricle, ventricle, and then into the pulmonary artery from here to the lungs where they get oxygen, and then return to the heart through the left pulmonary veins, to the pulmonary veins to left atrium, and then eventually left ventricle, and then out through the aorta to supply the other parts of the body. So narrowing it down, so this is what we are discussing. This is the heart that has been cut open, and this is the lung that has been they have been cut open also, the two lungs, the left lung and the right lung, both of them beside, just on both sides of the heart. So blood from the lower part of the body will come back to the right atrium as mentioned. Blood from the upper part come back through the SVC to the right atrium. Eventually they enter the right ventricle. From the right ventricle they enter the pulmonary artery, and from there they enter the lungs to go and supply, to go and get oxygen. When they get oxygen eventually, they return to the heart, but this time around on the left part of the heart. That's why it's painted red, showing that it has collected oxygen. Then from the left atrium, left ventricle, and then aorta, and then supply different parts of the body. So in a normal person, you can look at this diagram here, shows a cut section of a pulmonary artery. The pulmonary pipe has been cut open at a point where it branches into two. This arrow is showing the stream of blood flowing through the normal pulmonary artery. You can see how thick the stream is. But in pulmonary hypertension, the wall of the artery becomes thick, and therefore makes the hole, the lumen, where blood flows, narrow, so that the stream of blood becomes very tiny. As this is also because of the pressure has started rising in the lungs. So the things that cause pulmonary hypertension are many. There could be because of blood clots, the one we're going to talk about today. There could be because of thickening of the walls. There could be because of scar tissues. So because the place that air is exchanged in the lungs, if there's an injury, maybe somebody has a pneumonia or TB or whatever, when the injury heals, the person can have scars upper. So when there are multiple scars in the lungs, it could lead to high pressure in the lungs. Then again, if somebody has a left heart problem with, maybe someone has a heart failure or has a problem with the valves on the left part of the heart, the pulmonary veins may start dilating, and this can also ultimately result to a type of hypertension. But this is now a pulmonary venous hypertension. It's not part of what we're going to discuss. So how is pulmonary hypertension classified? It's classified into group 1. This one is called pulmonary arterial hypertension. It could be due to unknown causes, familiar things, or due to taking of illegal drugs like mbulummiri causes pulmonary arterial hypertension. Then some of these drugs that ladies used to do weight loss therapy, like fenfluramine, it causes pulmonary hypertension. Then sickle cell patients have it, like I mentioned earlier on, HIV patients and all that. Then the type 2 is the commonest type. It's called the pulmonary hypertension due to left heart disease. So somebody who has heart failure or has mitral valve problems or aortic valve problems or problems in pulmonary veins can have heart failure, can have a pulmonary hypertension, but it's a pulmonary venous hypertension. Then the group 3 is pulmonary hypertension due to lung disease. For people who have things like emphysema or chronic bronchitis, there are some chronic cough, things that cause chronic cough can actually cause this type of pulmonary hypertension. But the one we're discussing today is the pulmonary hypertension caused by chronic blood clots or blockages in the pulmonary artery. That's the chronic thromboembolic pulmonary hypertension. Then group 5 is pulmonary hypertension triggered by other health conditions. So many other things could cause, if somebody has bad spleen or some blood disorders, excess red blood cells, excess platelets, and some leukemias and all that. They all cause pulmonary hypertension. So what are the symptoms? So when individuals have pulmonary hypertension, when they come to hospital, what do they complain about? They have progressive breathlessness, meaning that today the person may become breathless if he wants to move from here to the back of the building, but the next 1 month, he may become breathless while trying to walk out from here to the outside. By the time this gets bad, the person may be breathless even while lying in the bed. But heart failure shares these features with pulmonary hypertension. They could have chest pain or chest pressure. This is not common in heart failure. They may have dizziness or fainting attacks. It's also not common in heart failure, but heart failure patients, if they have heart block, can have fainting. Then they have a fast pulse or a pounding heart. It's also seen in some cases of heart failure. Then fatigue. Then dependent swelling. The legs may start swelling if the person is standing, or the back may start swelling if the person is lying down. Then noisy breathing, the type of noise that asthmatic patients make, that is whistling in nature. Those who have pulmonary hypertension oftentimes come with those symptoms. So these are the similarities and differences between the way these patients present to the hospital. So we began a search for pulmonary arterial hypertension after returning from Leuven. So following the good clinical response of our first patient to sildenafil is Viagra, that's the common name, but you know what Viagra does. So we went on to search for pulmonary arterial hypertension in patients with difficulty in breathing, as well as patients with leg swelling. So the second patient we found with this set of symptoms, again a female, in her early 40s then, she had severe pulmonary hypertension on echocardiography, had good clinical response to Viagra, but following extensive investigations, this lady was eventually found to have systemic lupus erythematosus. Before this diagnosis was made by Dr. Chibuzo Okwara, we were treating the person as if we were chemists. First of all, she was seen by the gastroenterologist who treated her for hepatic hemangioma. Then she was sent to us for breathlessness. We treated her for pulmonary hypertension. Then she was sent to the plastic surgeons for leg ulcer that was not healing. They treated for leg ulcer. But at a point, you felt that, this woman cannot be moving from one department to the other, and sent to a rheumatologist who made the diagnosis, placed her on treatment, and she has been well up to now. Then in 2017, we attended to a 48-year-old woman this time around who had acute pulmonary embolism, something that causes sudden death. We successfully managed this lady in the ICU with the help of anesthetists and then hematologists. In short, this is one of the most challenging cases I've ever had as a clinician. So after treatment, she was in the ICU for weeks. She got well, and we discharged her and placed her on a blood thinner for 6 months, hoping that by then the clots, wherever they were, would have disintegrated and the lady would be free. So after 6 months, we stopped the blood thinner. Some months later, she came back to the clinic, complaining of breathlessness again. So this is the woman's echo picture. For those who are familiar with echo, this arrow is surrounding an embolus in the right pulmonary artery, something that people really find. So the woman, when she came, we had to go and do the echo in casualty. I've kept this picture for almost how many years now? More than 8 years. Using to illustrate what pulmonary embolism looks like. But she survived this event. So when she came back to the clinic, she came back breathless on exertion. So we sent her for a test to look at the blood vessels in the legs. We call it Doppler examination. Doppler showed that she has clots in all the major vessels in both legs. We did echocardiography, which showed pulmonary hypertension. She was subsequently investigated. So we wanted to find out why was she forming clots for no reason. We did several tests. The test for screening for thrombophilia at that time was costing more than 100,000 naira. She was able to do it, but we found nothing. But in the course of evaluation, we found out that 2 of her brothers had died suddenly. Probably they had pulmonary embolism and died. So we started to place the woman on a blood thinner for life. She's currently on a blood thinner for life and has not had any problem in the last 6 years. The next patient we identified was in 2017. She was 41 years old at the time of diagnosis. She had been referred to us with a diagnosis of heart failure, question cause or query cause. Following echocardiographic exams and confirmation of severe pulmonary hypertension, we sent her for a test that is used to assess the way blood flows in the lungs, called pulmonary angiography. But this one is a CT-based pulmonary angiography. The result came out with a classical description reported by Dr. Nneka Elanusi. And this particular report was an eye-opener to me to the existence of thromboembolic pulmonary hypertension in our environment. Because a year or 2 before, I told Professor Boots that it was not available in Nigeria, and previous reports never reported it. So we managed that patient with blood thinners, Viagra initially. She got well and disappeared, came back after 1 year with worsening symptoms. We introduced more drugs, and she has been on 3 medications currently and has remained well. At this point, all the patients we had identified were all females. So we were beginning to think that this was a problem of females, particularly beautiful females. None of them was ugly, none of those ladies. All beautiful ladies. So this assumption cost us the life of the first male patient we would have saved. This 40-year-old obese PhD holder had seen us on a Thursday at the military hospital, complaining of breathlessness on exertion, as well as wheezing. These symptoms had worsened in the past few days before he came. However, he told us that he had been asthmatic. So we felt that the same asthma was what actually the problem with him, and placed him on conventional asthma medications and discharged him, asked him to go home. He didn't need admission. 2 days later, he called that he wanted to do an ECG because of a pounding heart. We did the ECG on a Saturday night, and the only finding was a fast heart rate. We still felt, well, you're not using your inhaler very well, taught him how to use the inhaler, and asked him to go home. The next day, the Sunday, the wife came back from church and saw the man on the floor with labored breathing. He was rushed to a nearby hospital where he was attended to by a respiratory physician, but died a few hours later. The family declined autopsy because, in our place, we don't like autopsy because if they do autopsy on you, when you come back in the next world, your heart may be missing or your eyes may be missing. So, and this particular incident was a defining moment for me in decision taking. What it now meant to me that each time I saw a patient with similar symptoms, we started treatments, and it has saved a lot of people. So in December 2017, we encountered another male patient. This one, a more deceptive presentation. He had traveled to the village for Christmas, and while in the village, the bush around his house was set on fire by local hunters. So he inhaled some fumes from the bush burning and subsequently started wheezing and coughing with worsening breathlessness, which ordinarily one would think is asthma. But he had no history of asthma. So we did echocardiography on him, confirmed pulmonary hypertension, and sent him for CTPA, that's the CT pulmonary angiography. But while on that, we started him on treatment. But mysteriously, the CTPA report came back and said it was normal. But we didn't want to take that, so we had to go in search of our darling Dr. Nneka Lanusi for a second opinion. And again, the description was classical. This man had a treatment for 6 months, recovered completely. The repeat echocardiography we did some months later was normal. Angiography was normal, and patient had remained off medications up to this moment. And I guess the man is in this hall. So in the ensuing 6 years, we have identified over 45 new patients with hypertension and CT evidence of thromboembolic cause. And most of them are doing well. Some are on medications, some are off medications. There are many medications used to treat this disease, but a lot of them are not available in Nigeria. Now, to make the diagnosis, echocardiography costs about 20 to 40,000, depending on where you do it. CT pulmonary angiography costs about 120,000, depending on where you do it. So in the last 6 years, we've sent more than 100 patients for CT pulmonary angiography, but less than half have been able to do that because of the cost. So the implication is that a significant number of patients with pulmonary arterial hypertension, you may not ever be able to find the cost because the patients are not able to afford the costs of the diagnostic investigation. Like I mentioned, if you go to do conventional CT angiography, it costs about 500,000 naira. And I'm sure most of us cannot afford it. So we subsequently set out to look for symptoms and signs that could be diagnostic of thromboembolic pulmonary hypertension, bearing our environment in mind. So in 2021, at the annual conference of the Nigerian Cardiac Society in Lagos, we presented a paper titled Rapidly Progressive Breathlessness, Diagnosing Thromboembolic Pulmonary Hypertension in Resource-Poor Settings. In that particular paper, the classical clinical features were one, female gender. So most people who have pulmonary hypertension are females, particularly in the 30s or 40s. Then the history of a syncopal attack. If a woman who has breathlessness maybe reports about fainting either once or twice, we'll think more of pulmonary hypertension from CTEF than other things. Chest pain is also another important symptom. Then wheeze, as if the person is asthmatic. Then obesity, and then particularly the presence of fibroid. So practically all the ladies who've had all have one side of fibroid or the other. The reason being that the fibroid, when the person lies down, lies on the IVC and the pelvic vessels and causes stasis blood will no longer be flowing back and the blood clot forms there. When the person moves around, some of them can dislodge and go to the lungs. So we took these descriptions to the international level in a paper titled Pre-Capillary Pulmonary Hypertension in Nigeria, Etiology and Clinical Features at the proceedings of the 20th Scientific Meeting of the International Society of Hypertension in Japan in 2022. In that particular paper, the commonest cause of pre-capillary pulmonary hypertension was thromboembolic pulmonary hypertension, followed by cases that couldn't find the cause, and then individuals who have holes in the heart. So from saying that we don't have pulmonary arterial hypertension in Nigeria to saying that it is the commonest thing that causes pulmonary arterial hypertension in our place. Unfortunately, this paper was only accepted for poster presentation because the reviewers found it difficult to understand why we could not do CT angiography for them. So I was telling them that in our place that it was so expensive that so that the aim of the paper was to tell them what clinical features could be used to correctly diagnose pulmonary arterial hypertension, but we were talking to the wrong audience. So in that same paper, again, obesity, uterine fibroids, and diabetes were the greatest risk factors for development of CTEPH. And when we analyze the symptoms, the features further, it showed that a combination of breathlessness, chest pain, and whistling sound significantly identified those with CTEPH. Although it was not supported by statistics, the history of syncopal attack was almost predictive of thromboembolic pulmonary hypertension in almost 100% of the cases. We have used these clinical features to correctly diagnose thromboembolic pulmonary hypertension in more than 62% of patients we have seen in the last 1 year. On one particular night, Professor Sam Mbo, I'm sure he's here, the renowned radiologist, called me at about 2 a.m. on one night, on a particular night, expressing his worry about a patient they had done a CTPA on, which showed a thromboembolic pulmonary hypertension. I quietly reassured him that the patient had been started on treatment even before the test was done, that the man wasn't going to have any problems. The elderly man has had his medication for 6 months and is currently doing very well. Just this last week, on the 9th of this month, that's last week Thursday, we had this patient that came for echo. Again, sorry. Oh, sorry, I wanted to play this thing. I don't know what this was. Chimangoma. How do I remove this pointer? I want to remove this pointer. This laser pointer. How do I remove it? Pointer options. Okay. I want to remove the pointer. Click.
Just press it. Oh, for the video.
I want to remove the laser pointer. Okay. Okay. No, it's still there. If you go back to it's still there. You also click on what?
Yes.
Okay. Okay. Sorry. So we saw this patient last week, Thursday. She had come for referral for heart failure, query cause. And maybe the image is not very clear. But when you see this type of thing on echocardiography, you can see the shape of the heart is like a D. If you look at those who have echoes, this thing is like the letter D. So when we see this D sign on echocardiography, it tells the person has a pulmonary hypertension. Lady was 32 years. When she came and said the referral letter, she came just for echo, said heart failure, query cause. And the first thing I asked was, when was the last time I had pregnancy? She said that she hadn't been pregnant before because I was thinking of peripartum cardiomyopathy. Then when she said she hadn't been pregnant before, I knew we had a case in our hand. And when we saw this, of course, we knew it was going to be pulmonary hypertension. Then the other image is this. You can see the right part of the heart, much, much dilated compared to the left part of the heart. So this is a classical way they present on echocardiography. So, this is one of the secrets of our success story in the management of patients with suspected heart failure. a lot of these patients will have received different types of treatment for heart failure without improvements and get pleasantly surprised when just 2 small medications, Viagra and these brothers, do the magic. But one major challenge we've had over the years is wrong advice given to dispensers of medications in respect of use of Viagra and Tadalis. So when female patients go to buy this medication, the chemist will tell them, don't take this medicine, no. That women don't take it, or that old people don't take it because they only know Viagra for the other function it does. But we use it for something else in this case. So the number of medications used for CTEPH has been on the increase, but only a few are available in Nigeria. Balloon pulmonary angioplasty is a treatment of option for those who are not doing well on medical therapy, but it's not available in Nigeria. Also, pulmonary endarterectomy is a surgical method that can be used to reduce the pressure of blood in the lungs. These other modalities of treatment are not yet available in Nigeria, but we hope that some of our colleagues may be willing to go for training in such areas. So in summary, as you measure your systemic blood pressure using the standard BP machine, also remember the need to measure your pulmonary blood pressure. When you come for echocardiography, we can easily estimate your pulmonary blood pressure because you have to be in business. Not all patients who have breathless exertion and leg swelling have heart failure, because once somebody has breathless exertion, has leg swelling, the first thing, of course, you think about is heart failure, but not all of them have heart failure. And being a female in your 30s or 40s puts you at a great risk for chronic thromboembolic pulmonary hypertension, but men could also have it. The presence of uterine fibroid, particularly for our gynecologists, when you have patients who have uterine fibroids, before you take them to theater, send them for echo so that we can tell you whether they have pulmonary hypertension or not, because some of them are down on the table when you carry them to the theater. Unexplained fainting, particularly in females with suggestive symptoms, could be predictive of CTEPH. What do we hope to do in future? We shall continue to increase our database of CTEPH, encourage some of our colleagues to go for training on right heart catheterization as well as balloon angioplasty. We will advocate for support by the government or whoever to biomedical companies to help them develop non-invasive ways of routinely measuring pulmonary blood pressure, because as of now, there's no way of measuring it like the systemic blood pressure. So appreciation, I need to thank my parents. I need to thank God first for the favors he has shown me, and ask him to continue showing me mercy despite my shortcomings. I appreciate our Vice Chancellor, Professor Arinze Chukwu-Igwe, the Deputy Vice Chancellor, UNEC, my friend, the Provost of College of Medicine, the Provost of College of Postgraduate Studies, Professor Binjoku, and the Deans that have worked with us in the last 2 years, the HODs, and all the staff that have worked with us in the last two years. I also, in a special way, appreciate my boss, my Oga, the 13th Vice Chancellor of the University of Nigeria, Professor Batokolo, who insisted that I must be a lecturer. He was asking me to come and apply, but I refused, because the amount of money UNTH was paying us then was too attractive compared to what the university was paying. But I thank him very much for convincing me to join the academic side. I thank my parents, Chief Christian EJIM of blessed memory, and my mother, Miss Regina EJIM. Mama, when I can't forget, she's somewhere there. They were primary school teachers, and they brought me up the way primary school teachers bring up children. I also thank my cousin. His name is Peter Malo. Throughout my childhood, we lived only with boys. We never lived with any girl in our house. My mother didn't want girls in the house. So Peter taught me how to cook. In short, by the time I was in primary 6, I could cook virtually everything my mother was cooking. I also thank my maternal grandmother, who was continued giving me money even when I was in the final year in medical school at the age of 100 and something. In a special way, I appreciate this woman, Mrs. Ugwe John Uwezoke, who discovered my potentials and guided me in the correct path to academic excellence. She's the best teacher I've ever had. In 1989, when I wrote my term paper, I dedicated it to her. Incidentally, she's the mother of Dr. Ndubisi Uwezoke of the Department of Pediatrics. In 2001, her pupils, the pupils she taught at the Kulu Primary School and Central School in Nsukka, we organized a party for her in Enugu here and hosted her and gave her a large sum of money. But many people are overseas and doing very well. Thank you, ma. I'm not sure she's not here. I thank my classmates and teachers at Nsukka High School. Many of them are here. Our union has grown from strength to strength under the able leadership of Senior Prefect Barrister George Asogwa. Professor Ike Onyishi, who was the 201st inaugural lecturer of the University of Nigeria, was in my class. And there are others, Ndubisi Edoga, Uche Nebo, Tony Eze, Bernard Ago, Shijoko Buna, Sonny Ugu, Otankwaku, Levi, Atama, some of them are here. And our teachers, particularly Mrs. Patricia Okonkwo, who insisted that we must be responsible boys. Because at our school then, we learned everything. We learned the good, we learned the bad, and we learned the ugly. But this woman, even when we were giving suspension, insisted that some of us would come back and continue. I went on suspension as a secondary school student. I will thank in a special way Mr. Chukwu. He's seated here. In 1987, we didn't have a physician. The woman who was teaching us physics would go and copy examples from Abbott and Nercon and come and teach us in class. And being boys, we revolted and reported that to the principal. The principal flogged me for coming to report an inefficient teacher. So that particular week, about 10 people from my class left the school and went to STC. This woman, Mr. Okonkwo, came and started begging us and brought Mr. Chukwu. I told him that we haven't done physics before. He started from heat to teach us physics. And within 1 year, we covered Abbott and Nercon. Thank you very much, sir. I thank the national president of my association, Barrister Onyemuche Nnamani, and his national ESCO. Some of them are here. I thank my 1994 OMSA classmates, a phenomenal group of people, individuals, who have continued to relate as brothers and sisters since we first assembled in 1988. It's noteworthy that the CMD of UNTH, Obinon Odugo, a member of that class, Professor Uche Ijoma, a member of that class, Professor Fred Ugumba, a member of that class, Professor Bart Chukwu, a member of that class, Dr. Osita Nani, a member of that class, where are they? And many others. And it is also worth mentioning that there is a research group called the Center. Okay, so before that, my class organized the first ever teacher appreciation party in the College of Medicine. In December last year, we called 20 teachers, one from each of the departments that trained us in medical school, anatomy, physiology, biochemistry, up to medicine. Organized a party for them and gave each of them a substantial purse. And the class has been very supportive of me since I became the dean. Massive support from my class. It's also noteworthy that, whenever the VC is counting his achievements, he will mention Center for Translational and Implementation Research, CITUNN. It was established by a member of the 1994 class, Echezona Ezanolwe. The following teachers had special impact on me as a medical student. My namesake, Professor EMMANUEL Obikili. He's seated here, a past inaugural lecturer. Professor Luke Nwoye, Professor Peter Igwim is not here. 1 minute. Okay. Professor Peter Igwim, Dr. Christian Ezidiegu, a senior registrar then, when we were doing pathology, we had no teacher in morbid anatomy. All of them had left UNTH. And this young man taught us everything we know today in morbid anatomy. He's in far away United States of America. I'm sure he's watching this program. The class has ever been grateful to him. Dr. Joseph Odili, many people didn't like him then, but he was my friend, and he had a lot of impact on me. Professor Sylvester Ileje of Pediatrics, Dr. Enugu, late Dr. P.I. Okolo, who as CMD of UNTH never missed his Thursday clinics at MOP. He taught us so many things, including anchovy sauce. He was saying then, we didn't even know what it meant, but he taught us anchovy sauce. My Oga, Dr. Gabriel Njeze, who wanted me to be a surgeon at all costs, he had to go and report me to my traditional ruler that wanted to waste my talent in medicine. But when he started getting old and started having medical problems, he came and apologized. Professor Wilfred Mezwe made neuro and anatomy so easy. I really appreciate him, and other teachers as well. In a special way, I will thank my father in the profession, Professor B.J. Siongbere. I did cardiology because of him, and I'm sure he knows that. I thank my other cardiology teachers, Professor V.O. Ike, Dr. Enugu, late Professor Ben Anisuba, Venerable Professor Ike. Then I'm grateful for other teachers in the Department of Medicine, Dr. A.C. Nwabeze, a thorough clinician, late Professor J. Moli, C.K. Ijoma, Professor Lassie, who begged me severally to come to nephrology, but I refused because their patients were not surviving the day then. I thank Professor Nwoke Deko, late Professor Esther Febu, Professor Glad also, late Professor Edith Noroka, BC Onyenekwe, Eyumba, CP Chijoke, Jesse Chukwuka, and Ejike Arodiwe. I thank my contemporaries in the department, Prof. Ikenna Onwekwe, Uche Ijoma, Onodu Gobin, Christian Okafo, Nelson Ogwanobi, Rafa Nakwe, who are all professors. Chinwanekong, who has a Japan to America, and Professor Kareta Nonyedum, my deputy provost, and Girum Badiwe. I also thank my other colleagues in the cardiology unit, Pascal Njoko, NC Udora, Nek Udora, Tobechuku Jidobi, Esther Ekwe, and then all the members of staff of the Department of Medicine. In a special way, I thank the doctors who work with me at St. Patrick Hospital, Dr. Dobie Biefuna and Dr. Chiagoze Onyemalokwe. Our support staff at the ECHO room require special mention because they keep all the records of these things we're doing. Ogechukwu, Chinelo, and Tina, I thank you very much. I thank the staff of the Dean's Office, the Associate Deans, Christopher Obioko Koye, Godi Asuzu, our Faculty Officer, Obi Udog, our Secretary, Nameko Bona, Benedict Azroy, Chikeze, Chile Ononiwu, Jane Eze, Ijomo Kolo, Florence Honor, Anthony Mweze, my driver, Cecilia Atta, Josiah, Helen, Ifeinwa, Blessing, Ijoma, and Jessica. In a special, I need to appreciate my family. They're all seated here. You can see we're growing larger. This is not all of us. Somebody is missing there. My wife Ogechukwu is seated here. You can see she's pretty because I'm a handsome man. So I need to. Then my children, Ike is a biochemist. Where is Ike? Maybe somewhere. That's my wife. Ask Ike, he's a big boy. He works with Farms in Nigeria Limited. Ugochukwu is a house officer at UNTH. Chisomi is the madam of the house, a final year student at History and International. Chinaza is a medical student, second year. And Sabata Chede is a jambite. And Chisimde is still a toddler. Tobechukwu doesn't have a picture yet. So I want to thank other members of the EJIM family, my aunts, Mercy, Aloy, Amanchuku, Tango, Oluchi, Ifani, okay, and Chijoke. I thank my Omunna. In 1995, when we graduated, they bought a fig for me, and my contemporaries were very envious that your Omunna bought a fig for you. I mean, a beautiful Akosus fig. That much, I'm still using it up to today because it gives only correct values. It doesn't give wrong values because it came from the Omunna. I thank my late uncle, Romanus EJIM, a very upright and prudent man. My maternal uncle, Dr. Tony Eloike, I believe he's here, one of the very first doctors in my hometown. Basi Chepe, he bought me, when I was in school, he bought me the first iron and most of the provisions I used here at UNEC. Tony Uzodofa, Charlie Uzodofa, Christian Eloike, who taught me hunting. As a child, I could hunt very well, and Christian taught me how to hunt animals. Chibo Zamal is my dependent ally and assistant. I thank him very much. And my very good friends, Okay Meta, Stanley Deikyo, Jude Akabeze, Augustine Anibo, Uche Mwaga. It was through Uche that I met my late wife, and we have remained friends since 1995. Afamudan, Farms in Nigeria Limited, and then Chibo Zonyama, the owner of Conquest. I thank Hassan Udogo. Hassan Udogo, where you can see a combination of Hausa name and Igbo name. This apparel I'm wearing came into Nigeria yesterday. Cut of this, my friend. It is the regalia of the American College of Cardiology. Hassan Udogo sent it all the way from Chicago. Then, in a special way, I will thank these individuals. Engineer Festus Oshaba, Ferrotex. A lot of the things I have done as dean in the faculty in terms of structural developments are actually from financial assistance from this guy. Ferrotex is not here. And of course, his friend and neighbor, Dr. Kinsley Eze, Tennessee. They are my friends, and they've been supporting me massively as the dean of the Faculty of Clinical Sciences. I thank my very good friend, Igwe Young, EMMANUEL. He went to Abuja yesterday. And then, I must mention that when I became dean in 2022, I wrote a lot of letters to a lot of my alumni, doctors in government, friends, and all that our medical students needed buses to ferry them from either UNEC here or outside to UNTH. You know the way politicians do, they don't respond to things. I say, when you come for treatments, I'll pay you back. But Right Honorable Dr. Martin Oke responded. He got us a bus. Sure, the bus arrived in Enugu yesterday. A 2015 30-seater coaster model with AC and all that. The bus is parked there. He actually brought some of the ushers from both sides. And then my permanent ally in practice, Professor Frank Ezugu, the owner of St. Patrick Hospital, I remain grateful. Finally, I want to thank the committee of friends who worked tirelessly to put this event together. Heavily led by Professor Valugu, a past inaugural lecturer. I had to put inaugural lecturers in my committee so that they can guide me properly. And Christopher Eke, they are all past inaugural lecturers. Other members, Peter Kweme, who The Secretary, Kinsley Kwazi, Iko Kwasilina Kudora, and Kiro Machuku, the wife of the DVC, Uchena Ugu, the Sobek had mentioned Tony Onya, Nonso Keke, Obiako Koye. If anyone wafia, Philip Okere, Chibuz Okwara, Judah Kabaz, Stanley De, Okay, Metamogazi, for Machuku Guna, Cyril Luzoke, Oluchi Onishi, Angela Ugu, Tobechku Yido, Pascal and Joko, James Abe, Afome Moka, Cassidibe, Esther Ekwe, Pamela Koma, Ikemozo, Joseph Enebe, Etel Chime, Vincent and more, who had a surgery 2 days ago. Christian Okafor, Godwin Imo, Chukwudi Anibo, who is in far away somewhere, Ngozi Dim, Adobe Obiefuna, Afamu Dani, Peter Mba, not the governor, and then Chagozo Menyolukwe and Mamihe Ojako. We shall meet at the appropriate place. Thank you very much for listening. I also wish to recognize in a special way Dr. Luke Umbo, who is representing Senator Osita Ungu, the senator representing Enugu West Senatorial Zone. Dr. Luke Umbo, you're welcome, sir. Thank you very much for coming.
What a lecture that has been. He did a good job of keeping to time, considering the number of people that he listed for appreciation. May I invite the chairman, the deputy vice chancellor, Enugu campus, to make some presentations on behalf of the university and lace that up with his post-lecture comments. David Sisa.
Ladies and gentlemen, I think Professor EJIM deserves a very, please, standing ovation, please. Can we stand and clap for him, please? Let's stand and give him a very... please sit down. I think most of us here have benefited one thing or the other from this lecture. Even the uninitiated, I'm sure you've been able to go home with something. He was talking about the other high blood pressure. I didn't know the other high blood pressure, but myself, I have learned is a chronic thromboembolic pulmonary hypertension. So CTEF for short. So that is the hypertension he's talking about. And if you look at what he said, it's very, very easy. But my worry is the cost. Though he has identified the symptoms and the way he manages it, but the cost of investigation is way beyond the ordinary Nigerian. It means that for you to do a test, for you to discover that you have this type of hypertension, you have to be spending up to 500,000. And he said that most of us, which is true, I don't think there's any professor here that earns up to that amount. It means you have to save 1 month's salary and also wait for another month before you join it and do the test. But fortunately, he and his team have been looking at other means of dictating and managing patients with this type of hypertension, which is less expensive. So that's one of the things we have to take home with. And also, for the first time, I have seen a disease that women, is more, that has, the incidence of this, or prevalence, or the incidence of this disease is more in women. In most other ones, like the essential hypertension, you find out that men are more affected, but in this one, women are more affected. And he said it's beautiful women. So I don't know. He said it's beautiful women. We don't know why, but he will tell us later. And he will also tell us because today is his day. I'm not going to ask him why he decided to use Viagra as his, what informed his choice of Viagra as a form of treatment. Maybe later he will tell us that. So, ladies and gentlemen, this is a fantastic lecture. At least he kept us in suspense and we've been able to learn that other hypertension. And most of us, if you are feeling any of the symptoms that he has listed, please do well to go and see your cardiologist. Because if you wait long, it may lead to sudden death, like he has said. And that's not what we wish for any of us. So we are richly blessed by this lecture, and I want to congratulate Professor EJIM for giving us this wonderful lecture. Now, like the tradition is, the university will give you a certificate to commemorate this lecture that you have given today. Today is the 16th of May 2024. So on behalf of the Vice Chancellor, Professor Charles Arinze-Chukwuigwe, I want to present this certificate of presentation that reads, University of Nigeria, be it known that Professor Emmanuel EJIM of the Department of Clinical Medicine delivered the 204th inaugural lecture of the University of Nigeria entitled The Other High Blood Pressure, which looks like heart failure but also causes sudden death, on 16th day of May 2024. Congratulations. To go with that, the university is also presenting this plaque to you. This also has to do with to congratulate you for presenting this lecture. So, Chris, University of Nigeria Inaugural Lecture Series, Professor Emmanuel EJIM, 204th Inaugural Lecture on this day, Thursday, May 16, 2024. Congratulations. We also know that you have lots of friends. Many of them are seated here, both those that are here and those that are not here. We also want to present about 50 copies of your lecture that you distribute to your friends and family members. Ladies and gentlemen, let's sit back as we continue with other activities. Chairman.
Thank you very much, Chairman. May I make the following announcements? The next inaugural lecture, the 205th in the series, will hold on Thursday, May the 23rd, 2024, right here at Lady Mary Odili Auditorium, or the Moot Court, as some prefer to call it. And that will be presented by Professor Joy Ebele Ikebazu, Professor of Medical Biochemistry, who is the current Dean of the Faculty of Basic Medical Sciences. And she'll be speaking on the topic, Metabolic Harmony and Disharmony, Balancing Health and Lifestyle. Metabolic Harmony and Disharmony, Balancing Health and Lifestyle. Thursday, May the 23rd, exactly 1 week away from today. Professor Ikebazu would be speaking to us as the 205th inaugural lecturer of the University of Nigeria. I've also been handed down some kind of order for refreshment after today's inaugural lecture. Past inaugural lecturers, principal officers here present, have been requested to proceed to the office of the Deputy Vice Chancellor Enugu campus, where they'll be served lunch, Davis's office. Other special guests, you know yourselves, are requested to proceed to the CIMAC seminar room right across the lawn there to be served lunch, while others stay back, or others proceed to the main hall and the tent So the main hall is decorated and ready to be used, and there is also a big tent right in front of the main hall. And so all the others who have not been asked to proceed to the earlier venues have been asked to proceed to these places. So past inaugural lecturers, principal officers would proceed to the DVC's office. All the other special guests will proceed to CMAC Hall, while others make their way to the main hall, UNEC main hall, and to the tent in front of the main hall. Okay, and then the priests have also been requested to proceed to the parish house where they'll be served refreshment. So all the clergymen should proceed to the parish house where they'll be served lunch. Okay, is it this?
Yeah, correct. Okay, yeah.
Is it past or current?
Yeah, the past answer.
Okay, I understand a group of students would want to make a presentation to the 204th inaugural lecturer. I guess he's their teacher. So can I request the representative of the past OMSA, or the president of the past OMSA medical students, to come forward and make the presentation? His name is Obani Chisom Royal. Is that you?
All protocols duly observed. Good afternoon, sir. On behalf of the University of Nigeria Medical Students Association, we decided to present you a gift congratulating you on delivering your inaugural lecture. This was drawn by an on-site. It's a member of the final year class. He's currently holding the art. I would like to present it to you, sir. Presenting it here is the current OMSA president, the current OMSA vice president, PRO, and majority leader of the 027 class. Congratulations, sir.
Thank you very much. And so the chairman, I imagine we've come close to the end of the inaugural lecture. On behalf of the Senior Ceremonials Committee, therefore, it's my pleasure to thank everyone who has played a role in making today a great day for Professor EJIM and, of course, for the committee. I thank all the special guests who have come from out of town. But let me single out for special mention the 13th Vice Chancellor, who received some mention in the course of the lecture, Professor, Emeritus Professor Bato Enokolo, who is seated right here. I was hoping he would show up with his brand new Emeritus Professor's gown, but he chose otherwise. We had another brand new Emeritus Professor, the 14th Vice Chancellor, who couldn't stay until this minute, Emeritus Professor Benjamin Ozumba. We're going to get used to this emeritus thing. And there's another brand new emeritus professor in the hall, Emeritus Professor Basil Ezanolwe. Please, an applause for him. In his brand new gown. Thank you very much. Let me also thank the former Deputy Vice Chancellors, former Provosts, past inaugural lecturers who showed up in great numbers. I was worried if we had set aside enough seats to take them all, but it looks like we did, because the number grows every day. The number grows, particularly here in Enugu campus. Next week we'll be here to add one more to that row, or after today, Professor EJIM will take his place there, and then he can come from there to read his citation of whoever is presenting, because we'll keep a seat here for you and keep one there for you. Everything is possible. Okay, let me also thank
All right, so we are still in the mood of celebration, and I'm not standing here alone. I am standing here with the chairman himself. So let's get to meet him. Good afternoon, sir.
Good afternoon. How are you?
Very well, thank you. Please, can you tell us your name?
I'm Professor Valugu. I'm a professor of obstetrics and gynecology. I'm a past inaugural lecturer of University of Nigeria, Nsukka. In fact, I'm the 185th inaugural lecturer of University of Nigeria, Nsukka. Thank you very much.
All right, thank you so much. So I think you'll be in a better position to tell us what's going on here today.
Yeah, today Professor EJIM, Professor Emmanuel EJIM, a renowned cardiologist of University of Nigeria, Nsukka, just finished presenting the 204th inaugural lecture of the University of Nigeria, Nsukka. The title of his presentation or his lecture is the other BP, which causes hypertension and also causes sudden heart death. Yes. Which looks the other IBP, which looks like hypertension and also causes sudden death. Yes, and I'm privileged to be the LOC chairman of this great inaugural lecture.
All right, so please, can you tell us, maybe in one word, what's his personality like? How can you describe Professor EJIM as?
Professor EJIM is a man of the people. He's loved by everybody, both in the academia and even the political space. You can see the crowd here. An unprecedented crowd. You can see that the hall is filled to capacity. Everybody is here. You can see the number of past inaugural lecturers that came. You can see that how many two past vice chancellors of this university graced the occasion, and some other dignitaries. So to describe Professor EJIM is highly loved by everyone, and we're happy to support him in this great occasion.
All right, thank you so much, Professor. Can you please tell us your name again?
I'm Professor Valugu. I am a renowned obstetrician and gynecologist and a past inaugural lecturer of University of Nigeria, Nsukka. I am also the immediate past CMAC of University of Nigeria Teaching Hospital in Enugu. Thank you very much.
Thank you so much and have a blessed day.
And you too. Bye.
All right, let me bring him up.
Thank you very much. While you're standing, the Vice Chancellor's entourage will recede.
Maintain your standing position and allow the members of the high table to recess the hall. First, please, I want to recognize Chief Judge Emeritus and Honorable Justice who graced this occasion. To our distinguished guests, please, I am begging, just maintain your standing position and allow the members of the high table recess the hall first. Thank you. On behalf of the university management, I want to say a very big thank you for making this occasion an eventful one. We appreciate your presence. God bless you.
Nka?
Oh,
wow.
FSG, Enugu State.
Oh, interesting. Now I know. Okay, so please, can you tell us how you feel being here at this
I'm
point?
the national president of the Soccer High School Old Boys Association, the alumni association of Professor EJIM, the inaugural lecturer. He is one of our best, and one of the best in the state, and one of the best in the country, and probably one of the best in Africa and the continent.
Okay, so talking about the topic he just discussed, what can you really say about it?
I'm an old man, as you can see. I'm one of the people needing his expertise.
Exactly.
And I used to go to London.
Okay.
Because luckily for me, I'm also the chairman of AutoStar Transport. Ooh. And the company could afford to send me on medical trip to London.
Exactly.
But with the hardship in Nigeria today, and the high cost of dollar.
The picture, the faces.
Okay.
Okay, so I'm actually standing out here today with okay, let him do the introduction by himself. Good afternoon, sir.
My name is Sam Gelen.
Do you mind going further?
Capacity for the lecture of my very good friend Dr. EJIM. Actually came because I
Is it picking?
Central never.
Okay. All right, we're out here again, and of course, we have actually been giving you updates based on what's going on here today. Don't forget that this is GoPack TV, and my name is Maki MBKKY.
Go on. Oh, no matter how long it will last. You are
Okay, so we are still grinding it, and of course you are enjoying the view already. I am sitting out here with the prof himself. Good afternoon, Prof.
Good afternoon. Thank you very much.
You're welcome. Please, can you tell us your name?
I'm Professor Basden Omubere.
Okay. A lot of people want to know where you are. And,
Sorry?
a lot of people would like to know, Professor.
Okay, I'm a professor of cardiology. Like the inaugural lecturer mentioned that I was his father in medicine. That helped him to decide which area to specialize. And I've served in several capacities. I was Provost College of Medicine some years ago, and also chairman of the National Cardiothoracic Center of Excellence, where open heart surgeries are done at the University of Nigeria Teaching Hospital. So I've served in these few administrative capacities in the past.
Okay, being like a son to the man that just delivered the lecture, what can you say about his personality?
Well, he showed it in the lecture, and I've known him personally. I've known him at home. I've been as a father, so he's done very, very well. At his age and stage, to be Dean of Medical Sciences at the University of Nigeria is a very good achievement, and I'm sure he's going to achieve more in future.
Exactly. Let's talk about his choice of topic, the topic that he chose. What can you really say about that?
The inaugural lecture is for you to show why you became a professor. It's given by professors in universities, and he chose a topic within his area. When I gave my own, it was on hypertension, which is my area of specialization.
Okay.
So he showed that he does a lot of echocardiographies, things he used to look at the heart, and make sure the heart is functioning well. And you can only detect what he mentioned today using that echocardiograph machines, which he showed the pictures.
Exactly.
So he's been doing that a lot, everybody knows, for many years at the University of Nigeria Teaching Hospital. So it was no surprise to those of us who know him very well that he was given that, he chose that topic.
Exactly. All right, thank you so much, Prof. Please tell us your name once more.
Basden Omubere, Professor of Medicine and Cardiology.
Thank you so much, and have a beautiful day.
Sure, thank you very much.
You're welcome. Still out here, and this is Gopa TV. Don't forget, you're watching us live, and I am standing out here with an amazing human. Good afternoon, sir.
Good afternoon.
Please do you want to tell us your name?
My name is His Royal Majesty Igwe Dr. Chike Onodugo.
Igwe.
Igwe of Abo.
Oh, that's interesting, Igwe. So please, I want to ask the reason why you are here. Igwe, you left the kingdom. You're here. Why?
I'm here because Professor is a special person. I met him when he was a medical student.
There were about 4 or 5 of them. They were always together. Younger brother, who is also a professor. I think 5 of them are now professors. They were quite young, you know, and you know, they formed a big impression. And they were very, very intelligent guys, and they were, you know, high flyers. And I picked interest in him because I saw him as a humble, you know, gentleman, you know, even the way he speaks. When you start speaking, he will keep quiet and he will listen to you, and he will still come back and make his point. So when he called me and said, I'm doing my inaugural lecture, I said, I must be here. It will be sad if I'm not here. Exactly. And I'm here today. Exactly. And I'm happy that I'm here.
Okay, let's talk about his choice of topic, the topic he discussed today, because yes, the BP and the sudden, not technical, let's just take it from the top now. What can you make out of it?
I think it's a good paper. Okay. Listening to some of the things that he recommended and said we should do. Exactly. I think it's a good paper. Just leave it at that. Maybe you ask some of these other guys, you know, wearing the academic gown, they will talk about the technicality of the papers. One of the questions I've been asking is, how come in these inaugural lectures, we're not allowed to ask questions and there's no reviewer? That's one of the questions that I would love somebody to answer for me. Most inaugural lectures in the University of Nigeria, Nsukka, the lecturer will come in, deliver the paper, and that's it. You know, so why can't there be a few questions, 1, 2, 3 questions, and why can't there be a reviewer, somebody that will say, this is a good paper, summarize the paper, you know, and that's it. Why can't we have that? I would love one day to come in and see that happening.
It's all right. Yes. Okay, so we're going to deliver this message. Thank you so much for giving us your time. Yeah.
Thank you.
All right, Igwe. Thank you so much, Igwe. University of Nigeria. Okay, and I am standing right here with Miss
Chinaza EJIM.
Chinaza, I'm aware that the person that delivered the lecture today is your father. So what can you say about him, his personality?
Well, he's the best father anybody could ask for. He's always there, financially, physically, emotionally. He's just the best in everything he does.
Okay, so talking about the topic he delivered today, what can you say about it?
Well, I would say that the hypertension he was talking about, it's not something that, you know, is discussed enough in the country, and it needs to be looked into, because from what he even said, I think it's more like dangerous than the other hypertension that we know. So, yeah.
And to your mother,
God bless her.
Thank you so much, and of course your name again.
Chinaza EJIM.
All right, thank you so much, Chinaza. All right, bye. All right, I am not standing alone. If you look very well, you see that I am actually not standing alone. I'm standing with a very fair, amazing man. Good afternoon, sir.
Good afternoon.
How are you doing today, sir?
Fine, thank you.
Okay, sir, so let's go to the point. I mean, let's ask you what you're doing here today, I think.
I am here to celebrate my teacher.
Okay.
Yes, Professor EJIM was my teacher and is still my teacher when I did my residency specialist training at the UNTH.
Okay.
So when he has called us to share the joy of being recognized by the university in this way, we have nothing else to do than to honor the invitation.
Exactly. Sorry, pardon my manners. I should have started by asking your name. So what's your name?
My name is Fintan Ekochin. Fintan Ekochin.
A doctor?
Yes, I'm an internal medicine consultant and a specialist neurologist.
Wow.
Yes.
Okay. Okay, so as a doctor, how do you see the topic he just delivered, the lecture, his topic?
See, when you learn, you now become a teacher beyond what you've learned.
Exactly.
And that's what happened today. He has been trained as a doctor, he has been trained as a cardiologist, he has become a professor, and he now tells us things that he didn't learn, but experience, which is the best teacher has taught him.
Exactly.
So the hypertension that is not seen on checking your blood pressure, like every other person knows. Hypertension that, however, can cause you to have very bad experiences. So that is something that we've heard about it, but we don't know that much. So he has come with a big volume of knowledge from experience to teach, and that is what a professor is all about. It's not just a title.
So in one word, please, can you tell us his personality?
Professor EJIM has a lot of characteristics which I envy. He is very humane and he's so approachable, so down to earth, so friendly. So there are a lot of life lessons, maturity lessons I have learned from him, and I will continue to learn. Even how he comported himself today and here. People that may not have reached his levels in life are less approachable, to make it simple.
Thank you so much, doctor. Thank you so much. That was an amazing time.
Very much. Thank you very much.
Have a blessed day.
You too.
All right, thank you. All right, so we are gradually coming to the end of today. And of course, I told you that today is the 204th inaugural speech. And I'm standing right here with the lecturer himself, Professor EJIM is right here with me. And of course, the amiable wife is not left out. Good afternoon, Professor.
Good afternoon, GoPad TV.
Thank you. Prof, please can you tell us what's happening here? Because I guess it would be fine if we hear from you directly.
No, it was the 204th inaugural lecture of the University of Nigeria, which I delivered. Every professor is expected to deliver an inaugural lecture before he retires. So actually, supposed to be delivered as soon as you're made a professor, within 1 year. But it still comes, it's better late than never.
Exactly. Prof, a lot of persons were watching you online and they said a lot of beautiful things about you. Some persons were watching from outside the country and they were saying a whole lot of things about you. Please, yes, you just have to watch it. And please, Prof, let's come to your choice of topic, the topic you chose. Please, can you educate us more on that?
No, I'm sure you've heard about hypertension. You've heard about the one you must have heard about is the one that's a machine is a cuff is tied. That's the paper. Cuff is tied on your arm, and then it's read off the machine. That one is systemic hypertension. That's the one most people know about.
Exactly.
It causes stroke. It causes blindness. It causes heart failure, kidney failure, and all that. But that's not all about hypertension. So when you say hypertension, most people only know about that one. There is another hypertension that people don't really know about. Even those who know about it don't talk about it. Exactly. Those who talk about it don't bother do anything about it. We just want to create awareness that there is another type of hypertension which is not common like the systemic hypertension. There is also an illness because it kills people. Exactly. And if you don't attend to it, it continues killing people. But when the awareness is there, people know about it. But unfortunately, there's no way of measuring it just the same way you measure ordinary BP. For you to measure it, you have to go and do a test called angiography, which is about 500,000 naira. But the good thing is that there's a test we do, which costs about 20, 30, 40,000. That when you do it, that can be used to estimate that blood pressure. If you estimate it and it's high, you can start treatment early, before it damages the person's lungs and all that. But the problem, most people only come to hospital when the damage is already there. So we start treating from the complication to the primary problem. But usually, BP is better treated when it's there before it starts causing complications. But in pulmonary hypertension, because we don't measure it, people only come when they have problems, when they has damaged their heart or damaged part of the lung. So we want to create awareness that something like that exists. And people, when they go to see doctors, should even ask or request that after checking my systemic blood pressure, how do I check my pulmonary blood pressure? Because it's also a type of hypertension.
All right, Prof, before I let you go, I want you to say a word to the persons. I saw a lot of persons here. I saw the past the past House of Representative member, and also His Royal Highness. And a whole lot of persons came here just because of you today. So what can you say to these people?
I want to thank them. Most of them are my friends, my patients, my relations. We've been relating well. That's why they came to listen to the lecture, because because something that is not common, many people wanted to come and hear about it. Exactly. Because the way we structured the title, the other hypertension, the other type of high blood pressure. So I thank them for coming, and I hope they learned something that will be useful to them in the future.
All right, thank you so much, Prof, and please, thank you for this opportunity.
Thank you very much.
All right, Joe.